Hello and welcome to this afternoon broadcast on NewsX. I'm Saurav Sanyal and our top story this hour coming in from Gurugram. In a shocking incident of medical apathy in Gurugram, the parents of a 7-year-old dengue patient were allegedly billed for a whopping 16 lakh rupees for a 15-day stay at a hospital in Gurugram. But their daughter died at the end of the stay. The itemized bill, which runs into 19 pages, shows that Fortis Hospital charged the parents for 661 syringes and 2,700 gloves, among other items, that were supposedly used during the treatment. Meanwhile, following the outrage, Health Minister J.P. Nadda has taken note of the incident and has vowed all possible support to the bereaved family.
They told me that as per the Ulema procedure, you are not entitled to get an ambulance. Our doctor will remove the ventilator in your ambulance and you have to take the daughter to another hospital and get her death certificate. They will not give a death certificate. So these kind of things, the doctors, and they have not reported my daughter's death anywhere. They have not reported the severity of dengue which my daughter suffered. So these kind of things, they just want to keep their records clean. They don't want to showcase any casualty in their record.
हमने अभी भी कहा है कि हम लड़ाई पैसे के लिए उनसे नहीं लड़ रहे हैं, कुछ ऐसा नहीं है। हमारा मेन ये है कि हमको प्रॉपर्ली इन्फॉर्म नहीं किया गया या फिर उन्होंने ट्रीटमेंट को बहुत स्ट्रेच किया। वो ट्रीटमेंट शायद एक हफ्ते पहले उन्होंने उसका एमआरआई किया होता तो वही सेम रिजल्ट आना था जो लास्ट डे आया कि उसका ब्रेन बहुत ज़्यादा डैमेज हो गया है एंड देयर इज नो यूज ऑफ फॉलोइंग द केस।
Really, I think medical facilities in this country have to improve, one, and two, they have to see a sea change in terms of attitudes of doctors and the medical fraternity.
मेडिकल एथिक्स होता है, उस एथिक्स के अनुसार से ही काम करना चाहिए। इस पर कई एक्ट भी बने हुए हैं और उसके बावजूद अगर अपने में सुधार नहीं लाते हैं तो ये बड़ा ही दुर्भाग्यपूर्ण है। मुझे लगता है कि उसकी पूरी जांच घटना के विभाग के संज्ञान में आया है, उसकी पूरी जांच के आदेश हो चुका है। मुझे लगता है इसकी जांच होगी और जांच में कोई आंच नहीं और अगर उसमें जो भी प्रकार का दोषी पाए जाएंगे ऐसे लोगों पर कार्रवाई होगी।
As you can see, the family had paid whopping 15,60,000 rupees for this 15 days duration, and the family is alleging that they were charged for all the wrong reasons, and the hospital had prescribed expensive drugs for treatment. As you can see, they were charged for this nutritionist fee. The family is alleging that ever since Adya was admitted to Fortis Hospital, she was on ventilator and she was not eating anything. Then why they were charged for the nutritionist fee? Apart from these are the visit charges. These are the visits that were made by some of the eye specialists. Now, family is saying that since Adya's eyes were taped shut, why eye specialists were visiting them and why they were charged for this. But the most shocking thing in this entire bill summary is this merofenum, which is an antibiotic that was given to Adya. As you can see, one vial of this merofenum came to around 4491, but the other one, the same merofenum, came to around 65,000 rupees. So obviously the family is saying that this shows the medical apathy and medical corruption that was going on in this 5-star hospital.
And staying with this story, let's listen into what the Indian Medical Association has had to say.
Suffering from severe dengue. It's not simple dengue, it's a severe dengue, which cannot be treated by a tertiary hospital called Rockland. That means High Court has refused. Rockland is like a High Court. Referred to a Supreme Court, which is a Fortis, a bigger hospital. Admitted in ICU. Remains on ventilator for days together. For 13 days, SMS is sent every day's bill. Because the child dies, nothing comes with that you are overcharging it. Yes, every person has a right to have his redressal. He can go to the hospital and ask for a meeting with the medical superintendent. Kindly explain to me, kindly explain. I need a copy of the bill. I need a copy of the details. I need to have explanation for everything. If he is not satisfied, against a doctor, he can go to the council. And against a hospital, he can go to the directed health services. I've been told that the Minister of Health has already ordered an inquiry. Let the inquiry come. I don't think so. This statement that in an ICU bill of 1 lakh a day cannot come is not correct. We need to know how much bill would have come in AIMS, how much money government of India would have spent if such patient was admitted in AIMS. So we have to go on the merit of the case. Let the investigations come. It's too early to say that they have overcharged or a patient that charging 50,000 rupees or 1 lakh for a serious patient. A wrong message will go to the community, and tertiary care hospitals will not grow, and they will start not accepting such cases where you can buy the life by money.
So do you think there is a need for any kind of mechanism because
it's not poor people. You are supposed to go to the government hospital. Tertiary the 5-star hospitals are made for people who can afford, people who have insurance, people who have PSUs, and a percentage of cases we just have got a land which is free. So I don't think so we can say that all poor patients need to be treated in a tertiary private hospital free of cost. That's the duty of the government. Government should take care of rich or poor, all emergencies under the directive principles and Constitution 21. That's the responsibility of the government. Government cannot say that I cannot do that. Private hospitals don't charge it.
But sir, there is some humanitarian question that...
No, humanitarian grounds will come. In such cases, every hospital, it's the duty of the hospitals to give them humanitarian ground treatment for the first day. Every hospital is supposed to give them 1 day treatment free. Explain to the patient, if the patient can't afford, arrange a transfer to the nearest hospital. Humanitarian ground cannot come for 13 days. First day, yes. On humanitarian ground, you take care of the emergency, then transfer to a suitable place.